You recently had stem cell injections into your knee and now you're wondering, why does it hurt more? Is this normal? Is it working or not? That's what I'm covering in this video. My name is Dr. Garcia. I'm a leading expert in stem cell recovery. I'm excited to help you recover properly from your knee stem cell injections. Well, is it normal? Absolutely. And let me explain why. Let me explain the process on how stem cells will help your knee recover, but what's normal so you can understand that and worry less and ensure you're on that right path. So when stem cells are injected to a knee, their job is to find all the things that have issues with them and ultimately help them feel better. So these stem cells will come in and they'll find, in your knee, you're going to have two separate joint surfaces. You're going to have the top of the knee, which is the femur, and the bottom of the knee, which is your tibia. And those two joints, or those two bones come together and they create the knee joint. Well, what's going to happen is your stem cells are going to come in and figure out, well, this surface should be flat or as flat as possible. And sometimes as you age or through trauma, you create these small potholes or the little divots inside that, or you wear down some of the cartilage, or you wear down some of the ligaments. And ultimately, those stem cells, they don't know any better. Their job is just to attack things and make them feel like they are young again. Now, when they do this, they cause inflammation. They are a pro-inflammatory process. So think about this. Every time that you've ever sprained your ankle, strain your knee, strain your neck, what did you take? You took some anti-inflammatories. You wanted to calm down the inflammation. You wanted to feel better. Well, these stem cells, their job is to create inflammation. You have to think, well, why are we creating inflammation if they're trying to help? Well, their process is to come and repair that. Well, what it's going to do is, as if you, sprained your ankle or you bumped yourself and you created that bruise, these stem cells are going to cause more inflammation. They're going to come in, repair that tissue, cause it to swell, and that's the feeling that you're experiencing after these injections. Their job is to create inflammation, to signal all of our body's internal responses to then take that inflammation away. But they have to do the construction first. That's their job. And once you realize that, you felt it. You walked out, you had your injections, and you felt okay the next day. But maybe 2-3 days later, you start to realize, oh my goodness, I'm concerned that it's more swollen than ever. Is that normal? Yes. There's 3 phases to healing. Very, very critical. You don't have to love science, but what you do understand is what's standard. The first 3 to 5 days is what we call our inflammatory phase. This is whenever you get an injection or surgery or some type of injury, it's the most swelling that you'll see. So 3 to 5 days is the highest amount of swelling that you're going to see. Well, then you're going to go into this next phase, which is the proliferative phase. This is where all these beautiful cells come in and they start repairing everything. And that takes 21 to 28 days. So that's the 3-week mark, 2 to 3 week mark. And then once those cells start building more, now you get what we call collagen. It's going to come in and repair, and it's like scar tissue, and it's going to build all this tensile strength. So the first 2 to 3 days, you're extremely swollen. The next 2 to 3 weeks, you're starting to get more repair. All these cells are coming in, and then after that, after 4 to 6 weeks, that's when you have all this collagen. That's where you have all this scar tissue coming in. So for that time point, if you've had injections, you know what it feels like. The first 2 weeks felt like miserable. You were so swollen, and then it started to get better about that 4 to 6 week mark. But you're an active person. You want to get active again. So you are maybe a little impatient. Maybe you wanted to expedite that. So you start moving more and you realize your body fights back because it's not ready. So it starts swelling more. All your body is doing is saying, we're not done repairing, give us some more time. So usually by that 12-week mark, all that swelling, everything starts to feel good again. And that's when you get that actual repair process for the stem cells. For the first 12 weeks, it is repair mode. They are going in there and causing chaos, causing havoc, creating inflammation, creating swelling, so you can't move more because that's your body saying, let us do our job. If you continue to push us, we're going to push back. And so that's why you get flare-ups, or you get times where you get more swollen. So first 3 to 5 days, normal. First 14 days, starting to feel a little bit better. The 4 to 6 week mark, that's where you're starting to move just a little bit more, but it's the second 6 weeks that where you become a little bit more impatient. So should you be concerned if you're swelling more after your knee stem cell injections, there's a portion of that is very normal. That's a standard process. If you continue to get more swelling, you continue to have it past the 2-week mark, past the 4-week mark, past the 6-week mark, maybe past the 12-week mark, this is where you can consult with anybody who provided the injections, or maybe your primary care or your surgeon, whoever's been helping and overseeing your care. These are just general guidelines to help you understand what normal is, so you can see yourself within that, and then obviously not feel so bad or anxious or concerned that what you invested in, all the time, money, and energy is going to waste. A portion of that is very normal. Then you have to figure out with guidance, with support, to understand, is this appropriate for my time point? And that's where most people struggle. And if you're concerned about your time points, you're concerned about is this normal, is this not, reach out to me and my team at the Stem Cell Recovery Experts. We see people like you every single day, all over the world, online and virtually. What we do is we help determine your course of care. We see how many injected sites you've had, what does your knee condition look like, what have you been doing up to now, who have you been working with, who's your local physical therapist, who's the person who did the injections, and we can figure out, is this normal for your time path? A lot of times you'll find a lot of physical therapists have no idea how to manage stem cell injections, so they treat it like a normal injury, or they think of it as a normal surgery. And so they give you things that are a little bit too fast or too aggressive, but you only figure that out because you continue to get swollen. Well, if you're swollen past the 6-week mark, it's likely that you're working with somebody who's pushing you too much, or maybe your body needs a little bit of rest. In order to do that, every person is different, every body is different, and ultimately you're trying to figure out from a diagnostic standpoint, is this normal and should I slow down? And me and my team would be excited to be able to help you out. Just go through your case. Is this something that I need? Maybe you're on the right track, I wouldn't change anything. Ultimately, to give you that confidence and clarity that you're on that right path. So if you need that help, we'd be excited to help. Otherwise, enjoy your journey and stay calm. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.